So we have a story up at WBSM.com, and your folks, Jonathan Cavalli, your press man, put out a story yesterday that the city of New Bedford has been informed by the Massachusetts Executive Office of Health and Human Services the state does not intend to pay for care of MassHealth patients at the medical surge facility located on Acushnet Avenue. What are they telling you, Mayor? What do they mean by this?
I think they're looking around the state and saying, where do we have more capacity than we need, and they're trying to save some money. They're not closing the facility. The city leases it, but what they're saying is, we're not going to pay for patients there, at least ones that the state pays for directly, which is through the MassHealth program. And MassHealth is, I think most people know, is the state program that administers federal Medicaid. So what that means, in effect, is that the place can't open up, which, right now is fine because there are no patients there. I wish they had told us that a little bit sooner before we deployed a significant amount of manpower to fix up the place. But what they're saying is, you've got this other facility on Rockdale Avenue. It's about half full. We don't think that there's going to be a surge and in the foreseeable future, and so we don't need this other facility. I'm not as convinced that it won't be needed, and so the city will retain its rights under the lease to throw the lights back on in case there is a surge. So I'm not about to relinquish that property back to the property owner anytime soon, because you just don't know. And I say all this not to pick on the state. Look, there have been instances where I haven't agreed with what the state's doing, but I think in a time of crisis, you should keep the criticism to yourself. But I also think that that the public does need to know, what that facility will or will not be doing, given all the effort that was put into starting it up.
We're speaking with Mayor Jon Mitchell of New Bedford. So, it's funny to me to hear, I'm listening to the governor yesterday talking about reopening, and then later on we get this message that seems opposite, right? That we don't need all these beds. I happen to be in your camp, which is that it's better to have it and not need it. It's better to have it if we do need it going forward, because as they reopen the economy, just based on what the experts are saying to us, Mayor, I mean, I would expect there would be an increase in cases, right?
Increase in cases. The virus is going to be around for a while. It's not going anywhere. And, there's talk of vaccines, but honestly, it should be, the discussion around vaccine should not be about a when, but an if, in my view. But in any case, we will continue to see hospitalizations as a result of the spread of COVID-19, no matter what the reopening looks like, and we have to be ready. We don't want our medical system to be overwhelmed, and so we in New Bedford are going to continue to have this other facility in our hip pocket just in case.
Mayor, just broad strokes, how long do you think it would take you to, if we suddenly needed it, right? Come September, boom, we suddenly need it. What do you think how long would it take you and your team to get the place up and going again?
Yeah, so I think the short answer to that's about 2 weeks, just fine. It wouldn't be just us; it would also be an operator, the Essex Group, which operates the Brandon Woods facilities and is now operating the Rockdale Avenue facility and doing a great job at it, would be the likely operator, and so we could jump back into action if things got to be a little scary down the line.
And just so people understand, number one, this does not affect MassHealth patients really at all, because there's no one there right now, and so no one has any reason to be worried about their MassHealth benefits.
Yeah, that's a great point. Yeah, so there's still capacity at the first facility on Rockdale Avenue. That's about half full right now. So, look, I mean, if that place fills up, then we'll have to have the discussion again about restarting the one up in Sasquatch on Acushnet Avenue. But so like I said, we sent out that statement so that in keeping with our approach that the public needs to know as much as possible about what's going on, and and so that's why we did it. But we'll be ready in case things start to become a little more precarious.
We're speaking with Mayor Jon Mitchell of New Bedford. But just so people understand, the first facility that the city built is currently in use, which you said is about half full, right?
Yeah, about half full on Rockdale Avenue. There were 107 beds there, and I think there were right around 50, maybe a little bit more, occupied. And it's fully staffed up. It's running. So, I think it seems like it's all going reasonably well. The hospitalizations are up. We're not leveling off on hospitalizations that continue to go up. So, again, people should know that they're not skyrocketing, but they are going up, and so that's one of the things that's a little disconcerting about the state's decision. It's just to my mind, it's not obvious to me that that facility won't be needed. But as I said, we'll keep it in our hip pocket just in case.
No, I think that's a very wise decision. And again, we're in a better position to reopen because we have the additional healthcare facilities available should they be needed, which I think has always been the goal, right? To raise up enough healthcare resources so that you can have a normal society amidst the COVID-19 virus. Mayor, just one question totally off topic, and just to ask you to deliver more bad news. I assume the Whaling City Festival is canceled this year. Do we have an official announcement on that, or would it just...
Yeah, there haven't been any official announcements, but obviously there have been a lot of things that have been canceled over the course of the summer, and we're sorting through all those decisions. And so we'll have some more clarity I would think in the next week on that. That's still over a month and a half away.
Okay.
And so that's, as we know, the feast is not going to happen. The feast is such a huge event, and, it was and a fairly tightly compacted event in terms of the crowds. And so it's, that one was a pretty straightforward decision, but I think some of these other ones are likely to fall as well. So people should stay tuned.
Yeah,
and the reason
we
we do that, by the way, is we talk about reopening. The last things that are going to get reopened are big events, indoor events and even outdoor events. So people shouldn't expect, for instance, to see filled Major League Baseball stadiums this summer. I think that's really unlikely to happen. They might play, but they're going to play without a crowd. I think, obviously I don't control those decisions, but it's stuff like that will. That presents the highest risk of transmission, and therefore will be the last to be resumed.
All right. Hey, Mr. Mayor, I know you got a busy schedule in front of you, so I'll let you go, but I do appreciate you making some quick time for us this morning here on short notice to discuss that decision with us, and appreciate you keeping us posted.